And everybody, welcome Lisa, and please feel free to...
Thank you. Should I go up here? All right. All right, thank you. Thanks for coming, everybody. Good afternoon. As Pete said, I'm Lisa Korab. I'm a health insurance specialist. So I'm here today to talk about Medicare supplement plans and, a little bit about original Medicare. And, I want to just help you navigate your way around and through all this information. I mean, I'm sure a lot of you have realized that, during this time, during open enrollment, when you go out to your mailbox, you see piles of brochures from carriers. And then you try to flip through them, and it almost seems like you need a master's degree just to read through them. There's so much information, and it can be so tricky. So I'm going to try to break it down a little bit for you today. And like I said, first I want to go over original Medicare and make sure we understand that, and then get into supplement plans. So starting with the Medicare basics, we have the letters, Part A, Part B, as in boy, Part C, and Part D, as in dog. So Part A is the inpatient care. That's your hospitalization, skilled nursing, hospice. Typically, you receive Part A at no cost. So that's going to be when you turn 65 or if you've been on disability for 2 years or longer. But it's typically at no cost. There are some cases where you do have to pay, and that's a case-by-case basis. Part B, as in boy, is your outpatient treatment. So that's going to be doctor visits, ambulance rides, lab work that's done outside of the hospital, medical equipment. So you have access to that as well when you receive Part A. That typically costs, on average, $104.90 a month. Now, again, based on your income, that cost can be above that or it can be below that, but that's just the average cost, is $104.90. Part C is the insurance that covers Parts A and B, but it's offered through private insurance carriers. So it's going to take the place of your original Medicare. So if you were to get Part C coverage, which is also called a Medicare Advantage plan, you're going to have that private insurance carrier's card, and you're not going to use your original Medicare card anymore. Part D, as in dog, is your prescription coverage. Keep in mind that with Part D, you have to have it. Once you turn 65 or you go on Medicare, after you've been disabled for 2 years, whatever the case is, you have to have a Part D plan, whether you have prescription drugs or not. If you don't get a Part D plan when you go on Medicare, they can fine you for every month that you should have had it and you didn't. So make sure that you keep that in mind when you're navigating through all these options. Another option that you can have, and I'm going to get really into depth with this today, are the supplement plans, also called Medigap plans. Those are the plans where Part A and Part B original Medicare are going to be your primary insurance. And then the supplement plan fills in the gaps. It's going to fill in, depending upon which plan you go with, it's going to fill in the co-pays, the deductibles, the co-insurance, and again, I'm going to get more into detail with all of this. So those are the overviews of the different parts of Medicare. So Medicare supplement plan basics, what are they? Medicare supplement plans are offered by private insurance carriers. So you will have your option of United, which is also AARP, Aetna, Coventry, Blue Cross, you name it. They're the different carriers. There's a bunch of other carriers that offer it as well. So they're private insurance carriers. Like I said, A and B is still your primary form of insurance. So if you go to the doctor, again, you're using your red, white, and blue original Medicare card plus a supplement card. These plans are not HMOs or PPOs. Okay, so whereas Part C Advantage plans are typically HMOs or PPOs, you have to stay within a certain network. The supplement plans are not. Your network is, as long as your doctor accepts Medicare, you can go see them. So it's nationwide, and you don't need a primary doctor, as you would typically with an HMO and some PPOs, not all PPO plans, but you don't need a primary doctor with those. Referrals are not needed. So if you want to go to see a specialist, if you need an MRI, if you need some other service done, you don't need a referral if you're on a Medicare supplement plan. Now, these plans are all lettered A through N. Okay, again, we're in with a bunch more letters. If you look in your packets, in the Medigap Basics, it's section 2. Under Medigap Basics, it's page number 11. You'll see a chart there, and it has all the different letters that go across the top, and then you're going to see a bunch of percentages that go down the chart. So I'm going to get to that in a second, but a nice thing about comparing supplement plans is all the benefits for each particular letter, for each particular plan, are exactly the same, no matter which carrier you go with. For example, if you go with Blue Cross Blue Shield, Plan N, and you're looking at comparing Aetna's Plan N, they are going to be the exact same benefits. They have to be. So again, Plan F from one carrier is identical to Plan F from another carrier, and so on down the line with all the different letters. So if the benefits are all exactly the same, and the networks are all exactly the same, how are you going to find the best carrier that's going to fit your needs? How are you going to know which one to look for? Well, first and foremost, what I recommend is taking a look at their rating. Okay, you want to know what their financial rating is. You can find this out online through AM's Best. You can just look it up online, and it will say, A rating, B rating, and so on. I don't like to consider carriers that have less than an A rating. If you have to use the plan and you have claims, you want a carrier that's going to be around to pay the claims. You want a carrier that's going to have the money to pay your claims. So I recommend that's the rating is with the credit is what their credit worthiness is. So you definitely want to take a look at that. Also, you want to take a look at customer service. Again, you can look it up online. You can talk to a friend. You can speak with an agent. But you want to know how their customer service is. If you have an issue with a bill, with a claim, something if you go to the doctor, you want to be able to call the carrier and get answers. You don't want to call the carrier and be stuck talking to some computer and getting automatic replies. So I think that that's a big factor. So customer service would be the next thing I would look at. And then finally after that, price. If you have a plan, if they're all the same network, if they have great customer service and they have great ratings, why pay more for a plan than you have to? So I usually, I look at what's the least expensive one in the area. So that's how, I would recommend looking for a plan. How are the costs determined? There's 3 different ways that the carriers determine their costs. The first is community rated. And what that means is that everyone who's on the plans has the exact same cost. It doesn't matter what your age is. It doesn't matter. Everybody has the same cost, whether you're 65 or 95. The cost will only go up with inflation. Okay, so again, age doesn't matter on community rated. Then there's the issued age rated. What that means is you're going to pay whatever the cost is at the time that you purchase the plan. And then after that, your rate's only going to go up with inflation. Your rate should stay the same. The third way is the attained age rated. And this is the most common. This is the one where if you get the plan when you're 65, it's going to go up every year from that point forward. So you're going to have an increase when you turn 66, an increase at 67, and so on down the line. So that's the most common, but that's why when you look at these plans that have different, they all have the same benefits, but there's completely different pricing, it's because of the way their costs were determined, the way it was rated. So just a quick reminder before I get into going over the plans. You need to continue paying for Part B, which is the $104.90 or whatever your cost is. You need to continue to pay for that even when you're paying for a supplement plan. So some people think it goes away and it doesn't. It gets added to that. So, okay. At this time, I want to go through the chart. Like I said, it's section 2, which is Medigap Basics, and it's page number 11. Okay, so we have plans A through N. You'll see that there's a couple letters that are missing, and that's because these plans have gone away. They've gone away between the years 2006 and 2010. Now, if somebody has one of those plans already, and it's grandfathered in, you can still keep that plan, but nobody new can sign on to that plan. So if you know you have a different letter that's on here, or a different letter that's not on here, that's why. So I'm going to start at the left and start with Plan A, okay? Plan A, you'll see that it pays 100% of the coinsurance for the hospital costs. That means that you're going to pay the first deductible when you go into the hospital, which is $1,216. And that part's not on this paper. But you're going to pay that deductible. After you pay that deductible, you're not going to pay anything until the 365 reserve hospital days have been used up. Then you pay all costs. On Part A as well, it's going to pay 100% of the Part B coinsurance payment. Now, with this plan, you're still going to have to pay the $147 Part B deductible, but everything after that is pretty much covered. So Plan A, as far as price goes in the grand scheme of all these other plans, it's about the second least expensive one on here. So Plan K, which I'll get to in a little bit, Plan K is the least expensive coverage, but A is the second least expensive. So next we have Plan B. This is a middle of the road type plan. Plan B will actually pay for that $1,216 hospital deductible, okay? After that, it's still gonna pay all the costs of the hospital. Where it doesn't pay is with skilled nursing. After the 20th day of skilled nursing is when the Plan B does not pay. So that's where it's a little bit different than Plan A too. On Plan B, you also have the $147 deductible, and that's going to be for doctor visits and medical equipment and home health care. I'm going to spend a little bit more time on the plans that are more common and more popular that make a little bit more sense for people financially, but I want to give you guys an idea of what all these other plans entail. So Plan C. Plan C is actually almost the same cost as Plan F. We don't sell many Plan Cs, and I'll get into why in a second. It's they're almost the same cost as Plan F, but it just covers a little bit less. So Plan C is going to cover everything that's inpatient. So if you're in the hospital, you're not going to pay a dime on Plan C. But outpatient, when it comes to doctor visits and medical equipment and all that, you're not going to pay anything. But the part that you will pay for is Part B excess charges. So what are Part B excess charges? If you go into your doctor, you have an outpatient surgery, your doctor has a negotiated rate with Medicare. Your doctor says, all right, well, we're going to charge X for this surgery. Well, after your surgery, your doctor can come back to you and say, you know what, we don't feel like we were paid fairly. So we want to charge 15% more. Now that's the most that your doctor can charge. This Plan C will not pay that 15% more if your doctor decides to charge that amount. Now, what I was saying is Plan F, which is actually the next one I'm going to talk about, Plan F does pay for those Part B excess charges. And they're typically within $1 of each other when you're looking at these health insurance costs. So my recommendation is, typically to go with F if it's $1 more a month. And all you would be missing for that dollar would be the Part B excess charges. So it's good to have that and be safe and be covered. Plan F, as in Frank, is the best Medicare supplement coverage out there. It is one of the 2 top sellers that we have. And this plan, you really won't have money out of pocket if you use this plan. It covers everything in the hospital, it covers everything up to the 365 reserve hospital days that you have. So you know how after the Medicare will cover up to 365 days, and then after that on every plan, you're supposed to cover all costs. Well, this plan will cover everything up to that. Then when you have outpatient treatment, it'll cover all doctor visits. You won't have copays. It'll cover any hospice care. It'll cover any home health care. So it's, like I said, the best plan out there. And that being said, it's also the most expensive plan out there. So that, again, is Plan F. Plan N, as in Nancy, is the second most common plan that we sell. Plan N, if you're inpatient, if you're in the hospital, you're not going to pay anything on Plan N. It's identical to Plan F. If you have an outpatient, if you need to use it for outpatient and you want to go to your doctor, here's where it's different from Plan F. You have to pay the first $147. Okay, and that's in a year. So you pay the first $147. Then after that, when you see your doctor, whether it's a specialist or a primary doctor, you're going to have a copay up to $20 per visit. If you go to the ER, you're going to have a copay up to $50 per ER visit. Plan N, the big reason why there's a price difference between Plan N and Plan F, and there is a price difference, it's typically about $60 a month on average. And again, every carrier is different, so this is on average. Plan N does not cover the Part B excess charges that I was just speaking about. If your doctor decides to charge more, Plan N will not cover that. Plan F will. So that's, a big difference with Plan N. All right. I'm going to skip back to Plan K and Plan L. Now, Plan K is the least coverage that you're going to get through a supplement plan. It's also the least expensive. So, it kind of goes hand in hand. But on Plan K, if you go into the hospital, it's going to pay half of that deductible, the $1,216. After that, it'll pay the rest of your costs in the hospital. As far as other inpatient goes, with blood work or with hospice care, all of that, you're going to have to pay 50% of whatever it is. So you still have a little bit coming out of pocket on this plan. When it comes to outpatient, so when you go to your doctor, you still have the $147 Part B deductible. So you have to pay that first before you go go see your doctor or get blood work. After that, on Plan K, you're typically paying 50% on most of the out-of-pocket. So if you go to the doctor, you're going to pay 50%. You have to pay the 147, then you're paying 50%. So that's Plan K. Plan L, which is the last one I want to get to here, you're going to pay 25% of that hospital deductible, which is $304. So you're going to pay the first $304, then everything will be covered in the hospital after that. For almost everything else on the Part L plan, you're going to be paying 15%. So that's outpatient, that's your doctors, that's your medical device, all the medical devices that you might use as well. So that is the overview of most of the letters here. Like I said, Plans F and Plan N, those are the two that most people find would fit them best for with their needs and their budget. So it typically just makes the most sense. So, all right, I'm going to get into questions after this. So what's not covered on these supplement plans? We went through a lot of what is covered, but what's not covered? Dental, vision, hearing. So hearing aids would not be covered. Long-term care. This does not cover any long-term care. Disability and prescription is a big one that's not covered on here. You would, like I said before, you would need another prescription plan if you go with a supplement plan. So any of these other ones, dental, vision, hearing aids, you can always purchase another supplement plan that would carry that either discount. They would either give you a discount plan for those services, or they would give you some sort of, set amount for it. For instance, there's one plan that will give you $100 towards a vision exam, and then you would pay the rest. So there's different ways that they do it. So you would have to purchase, if you want those benefits, you'd have to purchase them separately. So, all right, so let's say you find a supplement plan. You say, this is the one that fits me, or I want to change my supplement plan. What's next? Well, unlike Part C and the prescription drug plan, so Part C is the Medicare Advantage plans. There's no open enrollment period for these Medicare supplement plans. So right now we're about to have October 15th to December 7th when you can change your Part C plan and your prescription plan. You can't do that with a supplement plan. So your open enrollment periods are 3 months before you turn 65 or 6 months after your 65th birthday. It's when you go on Part B. So if you go on Part B a little bit later because you're coming off of employer's coverage, that will give you a guaranteed open enrollment period. So you would be able to pick one of these supplement plans then. If you're coming off of an employer's plan, even if you were on an employer's plan and you had Part B, you would still be given an open enrollment period to go on one of these supplement plans. If you're moving out of the service area of your other plan, so if you're living in Florida and then you come to Pennsylvania and your carrier in Florida is not offered up here in Pennsylvania, that gives you a guaranteed open enrollment period for one of these plans. There's other special circumstances, but they're not as common. So what if it's not the open enrollment period? Now what? There's medical underwriting for the supplement plans. So what they're going to do, they ask you questions, and it's not a whole lot of questions, but there are some medical questions, and they're going to ask you questions on the application. Every carrier is different with the questions that they're going to ask you. Some carriers are much easier to get into than other carriers. So what we typically do is we would talk to you and see which would be the best fit for you. Or when you take a look at the application from the carrier, you'll be able to see, okay, you know what, this works for me, or I had a heart attack in the last 90 days, this one won't work for me, whatever the situation is. So, you would have, I'll fly up here. You would have that open enrollment period, or yeah, you would have that. So if you're on a Part C Medicare plan, the Advantage plan, you could only switch to a supplement plan between January 1st and February 14th. Why is that? It's because that's the only time of the year that you can disenroll from a Part C Medicare Advantage plan. So if you're on the Advantage plan and you want to switch to a supplement, it has to be during that period of January 1st to February 14th. So what we would do during that time, or what I would recommend during that time, is that you would first sign up for the supplement plan, if that's what you chose to do, or put in an application for the supplement plan. You can't have a supplement plan and an Advantage plan at the same time. But you would want to make sure that you're going to get coverage from the supplement plan. Make sure that the carrier is going to accept you. So you would apply for that. After you get accepted and you know that it's the coverage that you want, then you would drop your Advantage plan before starting the supplement plan. So it's a little bit of a process, but that's the safest way to do it, to make sure that you're not losing Medicare coverage. So to buy the actual supplement policy, you could either speak with an agent or you could contact the insurance carrier directly. They'll work with you directly as well. Like I said, there's an application process. So if you're in a guaranteed enrollment period, the application is much shorter. It's just your basic information. There's no health questions. If you're not in the guaranteed enrollment period, then you do have to answer medical questions. You do answer if you smoke any tobacco, and that's all going to determine your rate. It's going to determine the cost of what you're going to pay, and it's going to determine if they're going to accept you and if there's going to be any waiting periods for any of these plans. So, so just keep that in mind. After you apply the plan and you get accepted, the plan will typically start the first day of the month after you apply. It always starts on the 1st. You would then receive your welcome letter and your ID cards. So I want to also briefly touch on this again, because I can't stress this enough. Make sure you have prescription drug coverage, because the supplement plans do not include that. So whether you're taking drugs or not, just make sure you have that, the prescription drug plan. On Medicare.gov, you can go on there and type in your prescriptions, and they will point you in the direction of which is the best plan to fit your needs and your budget. So with the actual prescriptions you're taking. So if you haven't done that already, you can absolutely go on Medicare.gov and type in your prescriptions, and it tells you exactly which plan they would recommend. We also would do that for you. So that way you're not spending more than you have to. In the handouts that you received today is the information that I spoke about and more. So I know that this is a lot of information. I know that it's a lot to remember. So that's why we wanted to give you handouts to take with you so you can refer to it at home as well. So that being said, I can definitely open up for questions.
Got it.
Hold on one second, Ross.
Hang on 1 second, Ross. Go ahead.
So I'm sorry about that.
Okay, you said that the enrollment for Advantage plan is only, you can shift from Advantage to Medicare on January and February. How about the other way around? If you are already on the Medicare and then you want to switch to Advantage.
If you are on Medigap and you want to switch to Advantage, you can do that starting tomorrow. Between tomorrow and December 7th is when you can do it.
Okay.
So that's the open enrollment period for switching in the Med Advantage plans.
Okay. You haven't touched too much on the Advantage plan so far. Is there a different plan for Advantage Club?
Advantage plans are almost a completely different, they're completely different. They're set by the government as well. So yeah, we were mostly just going to talk about the supplements today.
Okay.
But the Advantage plans, they're all different plans. And like I said, they're mostly HMOs and PPOs. But again, you could go through the carrier directly, or you could speak to an agent about
Okay,
it.
so you're not going to talk about Advantage plan here?
Not really today, no. I'll be happy to talk about enrollment periods and everything for it.
Lisa, can I just one quick,
Sure.
I know you don't want to talk about Advantage, but is it possible that like an Aetna Advantage plan does not have prescription coverage? And if that's the case, is that person obligated to get a separate prescription plan?
Okay, so yes, there is an Aetna plan that doesn't have prescription coverage, okay? There's one Aetna plan in this county. I mean, every county is different. So there's one plan in this county that doesn't have prescription drug coverage, and there's two plans in this county that do have prescription drug coverage. If you are not on a prescription plan, like from the VA, for example, or through a group, through an employer, then you should absolutely go with one of the plans that have prescription drug coverage. You can't get a Part C Advantage plan and a separate standalone prescription drug plan. It's not allowed. If you're on a Part C Advantage plan and then you try to get a prescription drug plan, they will take your prescription drug plan and cancel your Advantage plan. So whichever is the last to go through CMS is the plan that you're gonna stick with. So to answer your question, now is the time that you would pick up that prescription drug plan if you don't have it through Part C. Okay.
I have two questions.
Sure.
One is maybe you could talk a little bit on how you make a decision between plans F and N. And my other question is, last year before Obamacare, I looked into another insurance and we were both denied because I think we were both in physical therapy at the time. With the change in a pre-existing disease clause, are you saying that during the open enrollment period, they are not allowed to ask you those medical questions and you are allowed to switch from one plan to the other regardless of what your medical history is or not?
Okay, I'll start with that one, that question. So the Obamacare, what you were just saying, that's for people 65 and under, or under 65. So those pre-existing, that doesn't pertain to Medicare. So there's always been this open enrollment period, but for Medicare, but this is the only time that you're allowed to change your Advantage plan or your prescription plan. So there's no medical questions. But if you're switching a supplement plan, they have every right to ask you medical questions. Right, yeah, oh yeah, so the supplement plan, you would have to, they would ask medical questions. They're not waived. So, yeah, so, and then I'm sorry, the first question, is she? Oh, between Plan N and Plan F. Typically, it comes down to price, where people are price-wise. Plan N, and I can give you the exact numbers with one carrier right off the top of my head. Plan N with one carrier is $133 a month for somebody who's 65. Plan F is $191 a month for somebody who's 65. So what it comes down to is, I would never say go with Plan F instead of Plan N because of that Part B deductible of $147. I would never say spend that extra money, every month in premiums for that. But what you need to be comfortable with is on Plan N, you don't have those Part B excess charges being covered. So it's a matter of where your comfort level is with that. Plan F will cover those excess charges.
So you don't think it has anything to do with how many visits you have, that kind of thing, versus?
I mean, we do take all of that into account, sure. When we're sitting down with somebody, we take into account, are you going to the doctor twice a year or are you going 3 times a month? So yeah, we would take that into account. But usually, it's not typically the 3 times a month, that somebody's going to the doctor. If that is the case, then they're usually pointing right towards Plan F because they want the best coverage out there. So it's, every situation's different, but it comes down to cost and, the monthly premium, what they can handle, and the Part B excess charges. Yes.
Have an Advantage program, why would you switch to a Medigap?
Again, it's all about preference, but on a lot of the supplement plans, you typically have a lot less financial exposure. So, and I'm thinking of a couple Advantage plans right off the bat where, you're paying a certain deductible or you're paying $300, and I'm just using round numbers, $300 a day that you're in the hospital up to 6 days. There are some people who will take a look at that and say, I don't want that. I want to know that if I'm going into hospital, I'm not going to have to pay anything. And in that case, that's when you would switch, or that's when you would want to switch to to a supplement plan.
Or you have a pre-existing condition, I would think.
I'm sorry?
Or you have a pre-existing condition.
Yes. Yes. So that's why some people would want to switch to it. It's just a matter of what benefits are available and which plan you have as far as an Advantage plan goes.
I have a question. You said Medigap, as long as the doctor accepts Medicare. What percentage of doctors accept Medicare?
I don't have an exact number of a percentage, but I know that a lot of them do, and I don't know of any hospitals that don't accept Medicare. So, so as far as doctors go, it's something that we would look up online beforehand, because that's easily, you can look that up. Or you can even call the doctor and say, do you accept Medicare? So, and that's another reason, too, just to expand on your question from earlier, why somebody would want to switch from an Advantage plan to a supplement plan. The network's much larger on the supplement plan. It's nationwide, and you don't need referrals, whereas a lot of Advantage plans you do. So, but to answer your question, I don't have an exact number on percentages, but it's a lot of doctors accept Medicare. So, and if you're worried about network, supplement plans are the safest one to go with. So.
What was the site where you went to get credit rating?
AM Best. AM as in Mary, Best.
You know how before Medicare, you're eligible for Medicare, you could be in a high deductible plan with a health savings account.
Yes.
Is there anything like that that extends into Medicare?
Yes, there is. It's called a medical savings account that you could get. Very few carriers offer them, but it's MSA is what it's called, and it's very similar to an HSA, the health savings account plan. So it is available. Yes.
Go ahead.
This may seem like a really simple, ridiculous question, but all those forms you get. My husband has had a lot of medical bills, surgeries, etc., and you get those forms that says this is not a bill, it's just itemized. Mm-hmm. Do I need to keep all them? He's had a lot of these things.
I always recommend holding on to them. Okay. And beyond even that, I recommend taking them, and when you do get if you do get an actual bill in from a doctor or a hospital, compare them. Compare it. Make sure you're not paying more, make sure you're not getting charged double.
Okay.
So I hear that happen a lot. So I would hold on to them.
I just want to know because they're very extensive. Mm-hmm. Thank you.
Yeah, absolutely.
I have two insurance companies, one with my husband's employer and one that I work for.
Yeah.
One I work for is primary, but I'm really primary in both because my husband passed away a few years ago. So I'm with ExxonMobil, and they have a $3,000 deductible. And I have my drug coverage with them. With General Electric, it's United Healthcare, the other one's Aetna. There's a $300 deductible. And I do not have prescription coverage because there's no coordination between with prescriptions. Just lately, I received a letter from General Electric that they want all retirees and their spouses to go to a Medicare supplement or Medicare policy. So I wanted to make sure with my company that this wouldn't interfere with their insurance. Mm-hmm. So I called them, And they said, as long as I didn't get a Part D drug coverage with somebody else, I could get a supplemental plan through General Electric. They also help subsidize this somewhat,
Okay.
as far as I know. I haven't gone into it too much because I had to find out from ExxonMobil first. And they said several people do have supplemental plans. So I have to let them know, I guess, by December 7th, if I want to do this.
Okay.
So would I be all right doing this, do you know?
I think that's definitely a question for the HR, for your contact at that, who's talking to you about the plans. Typically, we send you back to them because every company is different when it comes to what their guidelines are and their plans. So I'd be more than happy to speak with you in a little bit more detail, outside here, and maybe I could, help you out, point you in the right direction. So yeah, I'd be more than happy to do that.
There you go.
Lisa, we have an Advantage plan with D coverage. Now, they're telling me I don't have to do anything to be re-enrolled in 2015. Now, the supplemental plan joining starts January 1st.
Yes.
Am I getting into a problem here with the Advantage plan being activated January 1st, and I want to go into a supplement, which the enrollment period starts January 1st?
That's absolutely fine, because the disenrollment period for the Advantage plans starts January 1st. So that way you're guaranteed coverage from one plan or another during that time period. So what you could do is, and this is just an example, you could apply for the supplement plan January 2nd, okay? Then you find out if you were accepted. Let's say January 15th, you find out that you were accepted. Then you would call your Advantage plan and cancel that plan for February 1st, because that's when your supplement plan would start. So that's how
I will have coverage.
You would have coverage as long as you don't cancel that Advantage plan until you hear the okay from the supplement plan. I can't stress that enough.
That's what I'm concerned about.
Yep.
Thank you.
Yep, sure.
Could you briefly explain how often physicians do have those excess charges and under what circumstances? I thought that when a physician accepted assignment and accepted Medicare, they were locked into what Medicare gave as a reimbursement rate.
I can tell you this. If you and I were having this conversation 2 years ago, I would be saying, it rarely ever happens. You're safe on Plan N. They never charge more. I'm hearing it more and more and more. And who I hear it from, I don't hear it from our trainings when we get trained to do Medicare. I hear it from my clients, where they say, oh, it's a good thing because I had this outpatient surgery on my arm and my doctor charged this much more, so it's a good thing I had F. I'm hearing it more and more and more. So I don't have an exact percentage on how often it's happening, but they are allowed to charge that excess charge. That is allowed. So, and that's why it's popping up more and more, so.
Lisa, my wife and I are in Plan G,
Yes.
which is one of the plans you did not even mention. Did we
Yes.
make a mistake?
No mistake there. No mistake there. The reason why I actually skipped over G, just because Plan G is very similar to F. Okay, so where Plan F covers everything. Plan G is the only other plan that's going to cover those Part B excess charges. So you guys did a good pick there. But a lot of carriers don't even offer G. There's actually very few that do, which is another reason why I skipped over it. The difference with G is that you would pay that $147 deductible for your outpatient care. So you're going to pay that. Now, the price difference between G and F is so minuscule. It's so small that it's usually, we'll say just go with F, or you don't even have to pay, or you don't have to pay the $147.
More than $150.
Right.
So it covered the deductible, so to speak.
Right.
The difference.
Right. So in that case, yeah, again, it depends which carrier you go with because all the prices are different. So, but no, G is a good plan. You're fine. Yes.
So, one more question. Plan N, the 147 is the ceiling you have to pay for that year, and then you move to the $20 copay. $20 copay that, you know, for each
That you're
visit.
talking about Plan N, correct?
Yes.
Then yes, it's $147 is what you're going to pay for outpatient, and it's once per year. It doesn't matter if you use it on blood work. It doesn't matter if you use it on a doctor or a walker. You know, it's the $147. And then after that, it's up to a $20 copay for doctor visits. So correct. Huh?
Medicare only covers in the United States, is that correct?
Yes.
So if you could travel overseas, what do you do in that case? Take a suitcase full of money or what?
Well, I could watch that for you if you need me to, because there are plans that have coverage. No, yes, so yes, you're correct. Medicare is only in the United States. However, some of these supplement plans give you some coverage if you go overseas. I always recommend getting travel insurance, though, if you're going overseas. It's usually very inexpensive, and then you won't have to worry if something does happen to you over there, having the coordination of benefits and all that. So, I mean, that would be my recommendation, to get travel insurance, which usually a travel agent, if you're working with a travel agent, they could help you out, or again, you know, if you go online. But some of these plans do cover foreign travel emergency. So there's a lot of stipulations, though, so.
Lisa,
Oh, yes,
do the carriers put all their rates online for
They
these
do.
various plans?
they do.
So,
Mhm.
oh, yeah, you don't have to give them your name or anything, just go out there and get it?
Many of them do ask for your name and your email address, and then they'll send you the quotes. But there are some, and every carrier is different. There's some carriers that will just give you a chart, and you can take a look at the chart. There's other ones that will make you put in your information, they'll email it to you. And then there's other carriers that say, give us your phone number, we're sending you an agent. So, yeah, it depends which carrier.
And getting back to what you were saying earlier, can you be denied coverage with both the Advantage plans and the supplemental plans due to pre-existing conditions?
You can be denied coverage from the supplemental plans due to pre-existing conditions if it's not during one of those enrollment periods where you turn 65 or get Part B coverage, okay? So if you're in one of those periods where you just turned 65 or you're getting Part B for the first time, if you're in one of those, you can't be denied from Medicare supplements. Now, the Medicare Advantage plans, you can't be denied if you're switching plans between October 15th and December 7th. So during that time period, you could switch to any plan you want. It doesn't matter what your health situation is. There's no health questions asked.
During that open enrollment period, you cannot be denied.
Correct. For the Advantage plans. Yes, and prescription plans. I really can't do that. on a one-to-one setting, I'll do it, but I really can't do that now without getting into trouble. I like what I do for a living.
Lisa, if we wanted to use a resource like yourself, what kind of criteria could you share with us to selecting an insurance broker or somebody like yourself so we're not involved with somebody who really doesn't know what they're doing?
Sure. I usually say make sure they have a website. I mean, these are just my own personal things, you know, what I would do when looking for somebody. Make sure they have a website, see how long they've been doing this for, you know, because I can tell you that for myself personally, I get certified every year, okay? I have to do this every year for every carrier. We all have to if we want to sell Medicare. But I get everything I know from meeting with clients and from my customers. You know, when I hear what's actually going on when they try to use their plans or when they get claims, there's nothing like being in the field, you know, day in and day out. So see how long they've been doing it for. So, okay.
Go ahead, please.
And if you, obviously, if you look somebody up online and you see some bad reviews, there's, another hint not to go there.
Is there a licensure process for someone like you?
Oh, sure. So we had to get licensed to sell health insurance in general. And then after that, if you can sell Medicare, you have to be certified by the federal government to sell Medicare. And again, you have to do that every year. And then you have to get certified for each carrier that you're going to sell. So they do background checks. It might be more than you need to know, but they look into all that kind of stuff for you. So.
And do you want to care to give us some of your past experience? Tell us a little bit about you and your company.
Sure. Yes, I've been doing health insurance since 2008. So day in and day out, I've been doing this. So, I've been, like I said, I do health insurance for people under 65 and then Medicare for people over 65. I help out individuals who need to pay for their own health insurance and then people who are part of groups. And if their employer is providing it to them, I'll help out the employer as well. So I started Positive Insurance Solutions in 2009. And I have people who work for me. I have other sales agents. So, we're definitely equipped to help out our customers. So. I always say I work out of my car. I drive around everywhere, and I see all my clients. So I usually say I work out of my car.
We have time for one more question or one or two. Anything else? So just a kind of a quick wrap up. Our office has recently worked with Lisa on a couple of clients, and she does a fabulous job. As you can tell today, she's here only for your benefit, for your information. And the way we presented this as simplifying Medicare is basically simplifying is talking with her. Because, I've listened to what she said now several times, and I still don't necessarily know that I've got it down. And I still don't necessarily know that I'm a good resource to go to. But certainly she and her company would be a great resource to go to. So if you do have some specific questions or some personal issues, her contact information is on the front. She'd be happy to work with you or talk with you. And either her or one of her associates in her company would be happy to kind of see if she could do what she could do to help you. And she does it obviously in the best integrity and in the most sincere way. So anyway, Lisa, thank you very much.
Thank you.
All right, so I guess that wraps up the presentation. Hopefully you found it interesting, enjoyable, maybe learned a little bit. Maybe not a lot, but a little bit. But anyway, we're very happy to have Lisa, on not as part of my team, but as a relationship that we have. And we certainly encourage you to contact her or talk with her. And obviously, any other financial planning issues, any other financial planning concerns, obviously we're here to support you. Any investment issues, talk to Phil. But anyway, have a great day and thanks for coming. Appreciate it.